I'm Judy Shaw for NYC Floor Talk. Joining me today is Sean Duffy, co-founder and CEO of Omada Health. Sean, thanks so much for joining me.
Absolutely, Judy. Happy to, and good morning.
Sean, tell me about what Omada Health does and the offer you announced a few weeks ago.
Sure. So, firstly, Judy, just want to share my thoughts and prayers go out to everybody across the country afflicted with COVID-19 in this tough time here. So, Omada Health, we're a digital care company. More specifically, we support people with prediabetes, with type 2 diabetes, with hypertension, with depression, and with anxiety. And 2 weeks ago, we announced that we're offering our mental health programs for free to any employer, to any health plan across the country.
Wonderful. So now, Omada's origins are in chronic disease care with a focus on type 2 diabetes. How did you enter into the mental health care space, and why is this a focus right now?
Sure. So more broadly, Omada is a digital care company, and we are interested in care areas where it's very, very clear that through a combination of people and technology, you can support people from afar better than in person. And depression and anxiety is right in that strike zone. We actually entered that space, though we started in type 2 diabetes and obesity-related chronic disease, but we entered in that space because we found that so many of our participants with type 2 diabetes also had troubles with depression and anxiety. It was very clear we needed to meet that need. So that was really the genesis of us getting interested in supporting in those areas.
What's unique about your program, both in this offer and overall in a very active digital healthcare space or health space?
Yeah, so what I always love to highlight is really the fact that Omada cares a lot about powering the programs with people. So we have a mantra at Omada that's people matter, and then you can include technology, design, data science, devices, content, curriculum. It's really stringing all of those together in a great symphony that makes the difference for people from afar. And I think that matters ever more than before because folks across the country are in their homes, they're sheltering in place. People connection matters more in that context than ever before, and people support in improving care and health matters more than ever before.
Okay, and finally, Sean, where does Omada see itself and the digital health space generally on the other side of this crisis?
Yeah, absolutely. So the world's really in a crisis right now, and that is true for our employers and our health plans. Omada works with over 1,000 employers across the country, dozens of health plans, and what we found is they've asked us, well, how can you help our membership? How can you help our employees in the world of COVID-19? And I think we're going to see really two eras here. So era number one is digital care is a critical tool to support people from afar during COVID. For people that don't want to have to show up in person to their doctor's office, they are going to need digital care. That's very, very clear. Era number two, I believe, will be a boom in digital care on the other side of COVID because people have tried new ways of getting care, and they've liked it. So that's how I imagine it playing out over the next couple of years. And, of course, we want Omada to be a critical part in bringing more and more and more care to the cloud to add convenience, to reduce costs, and to really provide value for the country.
Sean, thank you so much for joining me on NYC Floor Talk.
Honor, Judy. Thanks for having me.